Okay. So order changes. Ryan White Services referral order has been activated. A CICC program referral order should be used instead. Key search term of the barium swallow has been added to the XR esophagus 74220 for searching in the ACI. The EMG NCS orders body area / part required question has been added. The XR esophagus 74220 appointment status will be changed to appointment needed, and financial auth will be changed to needed. Sweat chloride 89230 appointment status will be changed to appointment needed. CPAP titration will be changed to financial auth not needed. 24-hour and 48-hour Holter monitor orders. These orders will now expire in 7 days. So there are several code changes this month. Primarily, these orders, the current description has just been changed from AP lat or PA lat to 2 views instead. New medications we've added for CBD oil, and we've also added no prescribed meds. New codes, we have a T1015FI, FQHC, PT, IWC child. We have a T1015FDI, which is an FQHC, SOC, SBS, IWC child. And a J9203, which I'm not even going to try to pronounce, 0.1 milligrams. RX renew request. The following reasons have been added to the RX renew request denied drop down. Will call pharmacy for controlled substances refill. Duplicate RX renew request already refilled. Patient has transferred prescription to a new pharmacy. Patient should contact primary care provider. Medication discontinued by provider. Patient no longer taking this medication. Chart section changes. The PCC referral note will be moved to the outside records subfolder under provider notes in the chart viewer. It's currently under the correspondence folder. The MMC SPA scheduling form, regular IV fluids, LR and sodium chloride for routine procedures were removed. These are now handled by MMC internal order sets. Under bronchoscopy medications, a second line has been added per the request of the MMC SPA. Initiate subphase nasal approach for bronchoscopy. Problem list. When printing a problems list, the impression column will no longer print. SIU sensitive results note. A new note has been created for SIU sensitive results such as STIs. This note is not released to My Health at SIU Medicine patient portal. HPI text. HPI elements to include when describing the chronological development of the patient's present illness, location, quality, severity, duration, timing, context, modifying factors, associated signs and symptoms has been added to the above free text box. Referring providers, we're working to add all HSHS providers to the TextWorks Referring Provider Dictionary. This will allow us to CC notes to them and will enable e-referrals to be sent for those providers with a direct ID. This process will take some time because there are a number of providers, so just be on the lookout for them. PAH interface, which is Passavant Area Hospital. So beginning February 5th, Passavant will no longer fax paper results of labs and radiology to SIU providers, as these are interfacing into TouchWorks.
And from Passavant, they're no longer going to send papers.
And can everyone be sure that their phones are on mute, please? We're getting some background noise. And then our February helpful hints. So alerts. Reminder, please do not add ad hoc free text alerts in TouchWorks. The list of available alerts has been agreed upon by SIU, MHS, and SC. If there is an alert you would like added, please contact your CIAI support and they can request it. Injection documentation. According to SIU compliance, nurse notes are required for all injections that are not performed and documented in conjunction with a provider note. Documentation reminders. Order the medication and document the medication administration. Always confirm the amount being administered with the original order. When the ordering provider is a resident, the supervising provider needs to be the same for med admin, note signature, and billing provider, and this cannot be a resident. When an attending is the ordering provider, choose the attending provider for med admin, note signature, and billing provider. The checkbox for consent is obtained. Please select the VFC eligibility if applicable. Give the VIS statement with every immunization administration and document VIS given and the publication date of the VIS statement. This field needs verified every time. If a user changes the date, it changes for all users. Nurses should also fill in the supervised by attestation if a nurse note is being used, and be sure to bill for the correct amount that was administered and the administration if applicable. And that concludes the education and helpful hints for February. Does anyone have any questions?
No, we don't. Thank you.
Jill here in the room with us does have a question. Go ahead, Jill.
It's actually a little bit more of a comment. For if anybody thinks that the no medications prescribed seems a little redundant, if you're working for any of the patient-centered medical home locations or patient-centered specialty practice, the expectation moving forward is that we have addressed all medications prescribed or unprescribed that the patient is taking or not taking. And we found when Daniel and I were talking about this, you could not put multiple options for none. So now you can put no prescribed meds, no over-the-counters, and no herbals. So that's kind of what some of the background of that is, if it seems like it's a repeat of what maybe already exists.
Any other questions or comments? Okay, thank you all for joining, and we'll let you have the rest of your afternoon back.
Thanks, Daniel.
Thank you.
Thanks, Daniel. Hey, Daniel.
Yeah, Nick.
Hey, I just want to let you know I had two people from Team Cody that were on that came on late.